This is Jeff. Jeff has attention deficit hyperactivity disorder, or ADHD for short. At the end of this video, we hope you will get a clear understanding of the following: the causes of ADHD, the effects it has on cognition, emotion, and behavior, the structural and functional abnormalities in the brain, and methods of diagnosing and treating this disorder. ADHD is classified as a neurodevelopmental disorder, which means it begins during the developmental period, typically before age 17, affects the development of the brain, and is characterized by various cognitive, emotional, and behavioral effects. Along with Jeff, about 5% of children suffer from ADHD at any given time, boys outnumbering girls, and approximately 11% of children worldwide between ages of 4 to 17 have been diagnosed with this disorder by 2011. ADHD is speculated to have many possible causes. For example, genetics. Children with a first-degree relative who also has ADHD are 25% more likely to suffer from it as well. However, it is highly unlikely that only one gene is the cause, and it is most probably a complex interplay between many. Other causes may be being born prematurely or being of a very low birth weight. Finally, numerous studies have suggested that because of prenatal exposure to various toxic substances, the child's neurodevelopment processes are disturbed, resulting in changes in the brain, specifically in the areas of the circuits in the frontal brain regions. Just by deciphering the acronym, you can get a pretty good idea of the effects ADHD has. Attention Deficit Hyperactivity Disorder. 3 subtypes exist, all characterizing a set of slightly different symptoms. Children who suffer from ADHD-PI are those that show predominantly symptoms of difficulties concentrating and inattention. Children who suffer from ADHD-PH show predominantly symptoms of hyperactivity. Finally, children who suffer from ADHD-C show both inattentive and hyperactive symptoms, and this is the most common of the 3 subtypes. Let's elaborate on the symptomatology. In children with ADHD, many cognitive, emotional, and behavioral functions are impaired. First off, a cognitive function that is impaired is attention. Specific attention problems are found in selective attention, attentional alerting, and sustained attention. This is a great problem because it disrupts concentration, especially when the task at hand isn't that, interesting. Inhibition is also decreased, meaning that activities that involve patience or restraint are often not accomplished. Furthermore, functions that are central to regulation of goal-directed behavior, such as planning and organizing, are impaired. This often leads to further difficulties with academic achievement. Second of all, emotional functions are impaired. Often, children with ADHD have trouble making and keeping friends due to difficulties with connecting on an emotional level. Unfortunately, this leaves 50% of school-aged children with ADHD rejected by their peers, compared to only 10 to 15% of comparison youth. Furthermore, the comorbidity or likelihood of also having an anxiety disorder or major depression when already diagnosed with ADHD is 25 to 30% for both. Finally, behavioral functions are also impaired. Activity is increased, and children with ADHD are often described as always being on the run. Children may also have deficiencies in adaptive behaviors and may often engage in behavior more immature than would be expected for their age and intellectual level. Finally, about half of children with ADHD experience motor problems as well. By using various brain imaging techniques such as MRI scans, neuropsychologists have found various structural and functional abnormalities in the brain of ADHD patients. Compared to other children, those with ADHD have a cerebral volume that is 3.2% smaller, which is associated with attentional problems. Normally, the right prefrontal area is larger than the left. However, in children with ADHD, this asymmetry is absent, likely resulting in the problem with inhibition. Smaller sizes of the prefrontal cortex, caudate, and globus pallidus are also associated with poor inhibitory responses. Neuropsychologists also have shown a decreased sensitivity to rewards. This indicates a deficit in the reward system of children with ADHD, or there being too little of the neurotransmitter dopamine. This deficit may suggest the reason for problems concerning the regulation of motivated and goal-directed behavior. they would need more immediate and stronger rewards or punishments to stay motivated. Clinical neuropsychologists have been working hard on providing diagnosis and finding innovative treatment methods for children like Jeff. Often, to diagnose ADHD, neuropsychologists would assess the child's symptoms with regard to a diagnostic criteria such as that of the DSM-5. Additionally, tests can be used to measure specific problems in behavior and cognition that would furthermore provide a clear understanding of the child's condition. An example of such test is the test of everyday attention for children, which measures attentional difficulties. In regard to treatment, the multimodal treatment assessment study showed that both medication and a combination of medication plus behavioral treatment works equally best in children with ADHD. Stimulant medication are most often prescribed to children with ADHD, which increase dopamine and norepinephrine in the neural networks of the brain. 70 to 75% of children who receive medication show a decrease in symptoms of ADHD. But as with almost any type of medication, there are always concerns of side effects, such as sleep problems, decreased appetite, stomach pains, and headaches. Another concern is that stimulant used in children might be a risk factor for later substance abuse. Parents are vital for any child, so therapy must often include them. Parent training can be beneficial for treating ADHD, mostly for children between ages 4 to 12. During this therapy, parents are taught skills that help deal with children who have ADHD. So that's it. Hopefully by now you have a good understanding of what ADHD is and all of the consequences that it brings. However, we'd like to leave this info clip on a more positive note by asking you to think of what could be some positive aspects of having ADHD and how might these benefits be used to aid treatment or therapy.